Dr. Deniz Sarhaddi, we have you on the Business of Aesthetics podcast today. I'm so excited to formally meet you and chat. I feel like meeting other female surgeons is something that is just few and far between.
I know, right?
Um, so today, just started off, tell everybody, a little bit about you, your practice. We know you're in the St. Louis area and you
hmm
specialize in all things plastic surgery.
I do. So I'm in a private practice. I have three partners. My practice is mostly face and breast. I do the occasional tummy tuck, liposuction, things like that. Um, but I did my training in St. Louis at SLU in plastics, and then Emory for a year for fellowship for aesthetics, and then came back to St. Louis for private practice, and I've been there since 2020, which is an awesome time to start.
And give us a sense, let's say there are some residents listening or potentially
hmm
fellows. Walk us through your whole journey of deciding to do a fellowship at Emory
hmm
and then how you decided where you wanted to be, what kind of practice environment you wanted to be in.
That's a good question. So residency, you did ENT, correct? And then
Mhm.
facial plastics. So plastic surgery, we overlap a ton. And in residency, obviously, we did a ton of trauma, especially in St. Louis. Um, Ton of hand, ton of trauma, ton of breast reconstruction, face reconstruction, all that stuff. Not a ton of aesthetics. And I was in charge of the resident injectables clinic. Did you guys have one at your program? Where like Allergan, the different companies will give you product. And
We did a
so
little
I ran
bit,
that.
but
Yeah.
yeah.
So I ran that. I enjoyed it. And then I loved my oculoplastics rotation. And towards the end of residency, I actually didn't know what I wanted to do. I was like, I'll just do general plastics. I'll work at a VA. I'll do all the things that come in the door, that kind of thing. And then my husband at the time was like, are you kidding me? He's like, why don't you just do aesthetics? I was like, no, no, like it kind of feels like a cop out or it feels like you're selling out. Like, no, I don't want to. And then I talked to some mentors and they're like, no, you're pretty well cut out for this. You obviously enjoy it. You enjoyed your oculoplastics rotation with the eyelid stuff. And then I was like, okay, why not? So my towards the end of residency, I applied to the Aesthetic Society Fellowship. I only applied to four because I wanted something very specific. And worst case scenario, I was a fully trained plastic surgeon. That's okay. Um, so I applied to four programs, ranked Emory number one, and matched. And I spent like the best year of my life in Atlanta in fellowship. Fellowship was my favorite year of training.
Why
It
is
was
that?
amazing. You're just doing what you really want to do. It's very different from residency because you're basically an attending, you're fully trained. Um, you're working with people that you really want to work with because you don't have to do a fellowship. And
Yeah.
if you match to one and you really it's literally you're picking something and they're picking you and it's amazing. Whereas the residency match, you're going in after med school with very little information, really. Like we all feel like we know what we want to do, but it's based on a med student's
Hmm.
knowledge of the field, which is nothing. Once you go through residency, you're like, oh yeah, I didn't really know what I was getting to. And then the match process is kind of random and arbitrary, or at least it feels that way.
For sure.
Um, yeah. So fellowship, you don't need a fellowship after being fully trained, but it's like finishing school. Residency was the broad strokes, and then fellowship for me was just finishing school, the little details, the little things that you don't quite pick up along the way because you just don't have time to focus on it. You're doing so much other
Yeah.
stuff. But that's the advice I always give residents is if you want to do something niche, you should do a fellowship. It's easier to get hired. But worst case scenario, you're a plastic surgeon and you've trained in everything and you can handle pretty much anything that comes in the door.
So best year of your life, but you didn't
Yeah.
stay in Atlanta. Talk about
No.
coming back to
So
St. Louis.
I didn't stay in Atlanta. Again, I was married at the time and my husband was faculty at WashU. So we decided to just stay in St. Louis because his job was great and I had a wonderful job offer at my current practice. And they actually offered me a position before I graduated residency. So they were like, it's like kind of a one in, one out practice. One person retires and then someone else gets hired. Um, and one of their partners is planning on retiring and he retired on Friday and I started on Monday. So
Wow.
yeah, that's how that transition worked.
So give us a sense of the other three physicians in your practice and kind of how you guys kind of divvy up patients
Work.
and yeah.
So my partner's are Hurla Flund. He's always been a mentor, even through residency and the fellowship process. Um, he was president of the Aesthetic Society, very well connected, very well known, wonderful surgeon, wonderful partner. And he was one of the original partners in this practice, which was founded maybe like 40 years ago. Chris Prada also trained at SLU. He did a breast fellowship at Georgetown, and he has been in practice, I want to say around 15 years, something like that. Um, and then Charles Nathan joined St. Louis Cosmetic from another practice in St. Louis way before I started. So they've all been there for a very long time. And as a resident, I rotated through that practice because the SLU residents come through and rotate with us. So they were all kind of in that mentorship role for me, which is pretty cool. And then I went to fellowship and then they offered me a job before I even left, which is very flattering because you know how residency are like always beaten down
Yes.
to some degree. And then to have like the cosmetic guys be like, yeah, why don't you join us? I remember that day. I felt very good that day. I was like, oh my God, I'm not a total imposter. Like, this is awesome. I'm okay at
Yeah.
this. Um, so that's basically the dynamic. And at this point, I'm a partner in the practice and we're all colleagues and equal owners of the practice, which is pretty cool too, to go from being like their little resident to being their female partner. But so they have very established practices. They've been in St. Louis forever. They've been practicing forever. So a lot of the calls that come in, patients request a specific surgeon, and that's
Mhm.
a good thing. But the practice is so well established and has been around for so long in St. Louis. The practice itself has a good reputation. So people will call in and say, I want this procedure, or I'm interested in this. Who should I go to? So they either request someone or it's kind of like a round robin thing, depending on what the patient wants. If the patient calls and says, I want a female surgeon, like obviously that's me. If a patient calls and says, I want this specific procedure and that's not something that one of us does, then they have the option of the other ones. If they call and say, I want the soonest appointment, that kind of, they put people on different schedules. But basically, we try to keep it fair and it's just round robin, all things being equal in terms of how patient calls get, assigned to a specific surgeon. It's a very fair practice. I felt very lucky, especially with some of the experiences that my friends have had coming out of graduation and joining practices. I was like, wow, I got very, very lucky. Like their whole goal from the beginning was to have me stay and be a partner. And they treated
Mhm.
me in that way. So they treated me very fairly. They treated me like a colleague from the beginning because their goal is to just, have a partner and get on with it.
Yeah, it seems like it was really the perfect situation for you. And
It
I
was really nice.
also have friends that have joined different practices and it just didn't work out. And it's hindsight is a 2020 beast, you know?
It is. It is. And I always feel bad, but you can never tell. You never know how someone's going to be in partnership. You never know how finances are in a practice. My practice was really completely open book when we were talking about me coming on. I had access to any finances that I wanted, any P&Ls, everything. Um, so there was no sketchiness. There was no like you're an employee type of thing. Like from the
Mhm.
beginning, the intention was for me to become a partner in the
Yeah.
practice, which is also a really nice way to start.
Yeah, definitely. So you mentioned that you specialize more so in breast and face
Mhm.
and then do some other stuff. Is that like during your fellowship, did you start to have kind of a gravitational pull to those areas? Or is
Yeah,
that something that's evolved more like as you've been out on your own?
it's funny. I always was most interested in face. Always facelifts, neck lifts, eyelids, things like that. Body, a lot of body is kind of bread and butter for plastic surgery. You will do a lot of it in residency, breast reconstruction, breast reductions, that kind of stuff, tummy tucks, lipo. Um, I actively chose not to do massive weight loss body contouring. I was never super interested in it. A lot of heavy lifting, like quite literally a lot of heavy lifting and
Mhm.
big, big surgeries. And I like the finer details a little bit more. And my partners all do massive weight loss. So I don't do that, but I'll do everything else. But my practice has kind of evolved into face and breast, which I really like. I think it takes a while to, in practice, be able to like hone in on what your interests are rather than having to do everything that you're not necessarily super into and super excited about, even though you can
Yeah.
do it. Obviously, you'll do it well. Um, so I kind of feel lucky too. Like my partners do some face, but not the things that I do. And they sent me a lot of my referrals are from my partners. You know,
Yeah.
they'll see someone with a really heavy big neck and they're like, oh, go see Sarhaddi, like
Yeah.
put them on their schedule. So it's really nice in that sense. But yeah, face has always been my biggest interest. And then breast is just, it's fun, you know. I
Yeah,
like it.
I was looking back at some of we connected on Instagram and I still
Yeah.
remember this like beautiful brow lift that you did. And it's always
I
fun to
remember you reached out.
query like other surgeons, like what technique did you use? What approach did you use?
Hmm.
So tell us a little bit about, I think in training, you mentioned imposter syndrome. And I think in
Hmm.
training, our attendings tell us like the first few years out on your own can be a real challenge in terms
Yes.
of like building your skill and confidence, taking care of patients independently. How have you
Hmm.
seen yourself evolve over the last few years?
Oh my God. I was more confident as a chief resident than I was as a first year attending, which is
Hmm.
hilarious because I'm clearly not better as a chief resident than you are as a first year attending, but you don't have someone looking over your shoulder being like, that's what that's supposed to look like. Keep going.
Yeah.
Or afterwards being like, that's totally normal. It's going to settle out. You know, those kinds of things.
Hmm.
Um, so that's the scariest part. It's not the surgery, but it, the things that only come with time and experience, which is that's supposed to look like that. That's totally normal. That's going on the right track. Or this one, you're probably going to have to fix something down the line. Or that was the hardest part, I think, of being an attending. But luckily, again, I have three really experienced partners like right next to me. So I could always ask them for advice. I had my Fawad Nahai, which is my fellowship director. It was an absolute privilege just to be able to like call him and be like, does this look normal? Is this supposed to like, is this okay? And he's like, yeah, it's fine. You'll be fine. Gabby
Yeah.
Mioto, she was one of my fellowship mentors too. So you find yourself leaning a lot on the people who trained you and your partners if you have them, just to help you get through that self-doubt. Sorry, my dog is very grumpy anytime you hear something at the door. Um, yeah, it's very difficult. But I think with time, I know with time, as you start doing things more and more and you see like the healing process and the way things look, then you kind of start to come into your own and feel a little more confident. Like I've seen this before, it'll settle out, that kind of thing. And it's, you know, healing is a process and you're watching it and you're just as impatient as your patients, if not more so. And
Yeah.
you want to get to that result quickly so that you could be like, okay, I did an okay job. Like, good, I'm an all right surgeon type of thing. But that imposter syndrome really gets you. It really does. Especially when you're supposed to be the most confident one in the room.
OMG. You could not have said it better. Like we're coming up on 2 years here, and I feel like some of the most stressful days are when I see patients and they're like, oh my gosh, what about this, and this? And I
Hmm.
tell them, like, it's gonna settle out, it's gonna be fine.
Hmm.
But then I go home at night and I'm thinking, like, is it gonna settle out? Am I gonna need to
Yeah.
do a revision? Da, da, da.
Yeah.
And 99.9% of the time, things like
It's
that just
fine.
settle out. But man, you can really like eat yourself up with just like incessantly worrying about
Oh, yeah. I
patience.
lose
Yeah.
sleep. I take photos, you know, like pre-op photos for my markings, immediate post-op photos, first visit photos, and I torture myself with them. Like I
Yeah.
will look at them and be like, okay, like switch back, switch forth. Does this look even? Does that look symmetric? Is this okay? Is that okay? Like
Yeah.
literally torture myself. And that's okay. I do it a little bit less now in terms of literally losing sleep over it, over something that I'm like, time, vitamin T, you know, it'll be fine. But again, that only comes
How,
with experience.
yeah.
Being able to say I've seen this before.
How do you manage those times when you just feel like so overwhelmed or nervous? I mean, do you physically like tell yourself, I'm going to put my phone down and not look at these pictures? Like, are there things I know that you're like very into fashion? Like, are there things
Uh,
outside of medicine that you try to distract yourself with?
I have my dog. He's a huge distraction, even right now. When I'm feeling like that in particular, I'll just send it to some friends. And like people are like at my same level, not necessarily flying high every time, but I'll send it to my girlfriends who are also surgeons and be like, what do you think? And typically, just having that outside perspective, it like really calms me. I'm just like, okay, it's fine. Like,
Hmm.
one of my friends will call me and be like, I think her lip isn't working. I don't know if it's going to come back. I'm like, it'll come back. It'll be fine. Like, give it a week. It'll be fine. If it doesn't come back in a week, give it 2 weeks, that type of thing. And
Yeah.
she'll like run through all the steps that she did during surgery and be like, and then I approached it this way and this way. I'm like, it's fine. You did fine. Like, you know what you're doing. We all go through it. So when it comes to torturing myself, usually I can break the cycle by just like talking to someone
Hmm.
who's does what I do and can talk me off the ledge. Um, but as far as like hobbies outside of work, don't judge me. I don't have a lot of hobbies.
That
I don't have any
you're
hobbies.
you're a
I don't
busy
think I've ever had a
surgeon.
hobby.
Well,
Literally, I think about it. I'm like, who has hobbies? I don't have hobbies.
yeah.
I think what I
No,
do. I have my
I
dog. I take him for long walks. I have my
yeah.
friends and family and travel and all that. But I'm not like, yeah, I craft on the weekends. I just don't. I don't know.
Yeah.
Don't
Well,
judge.
I know we connect. No, no judgment. I don't have any hobbies either. I just try to keep the ones in my household alive, as my main
Yeah,
goal outside of work. But,
yeah.
um, so we connected. I found you on Instagram. I don't even know how necessarily I came upon your page, but for younger surgeons, or if there were any like nurse injectors that were listening to this
Mhm.
podcast, what are some great marketing things that you've learned, like maybe tips and tricks either on social media, website? You have
Along the
a
way.
beautiful website, by the way.
Thank you. One of my friends did that for me, but she owns a marketing firm, so she knows what she's doing. Yeah, she made my personal website when I first started because again, I'm in a partnership and the practice website was more for the practice and I wanted my own kind of personality. It's more of a landing page. It's not like too elaborate almost.
Yeah.
But she did a really nice job. I love it. Um, Most of what I learned about marketing is from one of my friends. She's an attorney in town and she keeps it really simple. And has over 1 million followers and like was so successful. She started her own firm and was like drowning in work and all that stuff. And what she taught me was like she literally has a formula for her videos. She's really good about videos. They're all like under a minute long, and it's all about education. Like
Hmm.
we have something that the average person doesn't have that we probably take for granted. And she was the one that got me to do my first video. She's like, A, nobody cares what you look like. You only care what you look like.
Yeah.
B, it doesn't have to be perfect and polished. Like people just want to hear what you have to say and like be able to relate to you. Nobody cares, if your hair is out of place or whatever. And C, she was like, things that most people don't know. And I guess I didn't really realize that because I'm only around other people who are either really into this stuff, like we're in a little bubble, like a little aesthetic surgical bubble. But she was like, why don't you just answer like the difference between Botox and filler? I'm like, everybody knows the difference between Botox and filler. She's like, I don't. I was like, oh, okay. Like that's easy enough. Like
Well,
silly things, silly little
and
things.
you've got all this stuff like right in your brain on the tip of your tongue. So it's not even
Yeah,
like you need to do any research. You just open your
no,
phone and
no. Just
make
hit
your
record,
videos.
make a little video that's not like too long or slow.
Do
And
you
we do
do
this
all
every day
that?
in consultation,
Yeah.
like
Do you
every
do
day.
all your videos yourself?
I do. I do. She helps me a lot because she's so fast at editing, but it's not like I pay someone to do that stuff. My photos, we have like when I first started the practice, we didn't have our own like photo room with like the proper lighting and the proper background. So we got two of those in the office. Um, so that improved the quality of our photos. And my medical assistant and our nurses are really good about making sure that everybody gets their pre-ops and post-ops. And that was a boards thing too. Like I had to have it,
Yeah.
be able to take and pass my boards. Um, so those photos are great. Those are just done in the office. And then my one of the girls in the office will just edit them and put them next to each other, like befores and afters
Hmm.
with our name on it. And then we post that ourselves. And then my friend Paige encourages me to do the videos. And if I'm being lazy about it, she's like, just take a bunch of clips and I'll put them together, and she'll edit it, that kind of thing. But again, it's just like leaning on your friends who are talented and motivated and into this stuff the same way that you are, or more into it than you are.
Yeah.
But I don't think I'm particularly good at marketing. I just kind of go with it. I try.
Well, I think being young is, I tell patients in consult, I'm like, I'm a young surgeon. That's good and bad,
Hmm.
for X number of reasons. But I think with marketing, perhaps I'll make a generalization that it seems less intimidating for us to like just open our phone, make a video and post it.
Uh-huh.
Whereas, older individuals may feel more intimidated to do stuff like
Hmm.
that.
Yeah, I would say so. Like my partners don't do as much, and they're much older than me. They don't, they're just, they almost don't need to, at least
Yeah.
here, because their practice is so established. They've been around for 20 years. Like people know them. So in that they're not as reliant on, social media and videos and things like that. Um, at the same time, I think the risk of the younger generation being really good at this stuff is that, and this, I hope this doesn't come off weird, but I feel like sometimes less experienced surgeons can come off as much more experienced or as experts.
Hmm.
And I think that's a little dangerous. I think everybody wants to be like Instagram famous and, the six-figure facelift and all those things. But that kind of it also comes with time.
Hmm.
So I would never get on there and be like, I'm the expert and you should listen to me. I've been in practice for 5 years, I do nice work. I love what I do. I learn from experts. You and I, we're always going to be learning forever. Um, so I find it very difficult to be like, I'm the expert. When I look at Fuad Naha, I'm like, no, he's the expert. He's been doing this for 50 years. Like he trained everyone.
Hmm.
Or Gabby Mioto, who trained me, and she's been doing this for, 15 years. Like she's more of an expert than I am, but obviously I still have a lot to offer, I think. So it's hard to walk that line and not seem, I don't know, like you're overstepping a little or feeling like you're tricking people into thinking that you're much more
Yep.
senior than you
No, I,
actually
I
are.
I totally get what you're saying.
Yeah.
Yep. Coming off as deceiving.
Kind of. Yeah. I would never want to be that way. I hope I don't come off that way. But I'm conscious of that. I'll put it that way. I don't know if it's an imposter syndrome thing or what, a girl thing, because I don't think a lot of guys would. I don't
Yeah.
know. Again, huge generalization, but
So let's talk about that a little bit. You mentioned you're the only female,
Mhm.
which I think comes with great things and sometimes some unique challenges. Do
Yeah.
you, um, tell us the dynamic with being the youngest, the most petite, and the only female in the practice. It sounds like you've got a good group. Do you sense that perhaps some of your friends or colleagues maybe are
Mhm.
treated differently, or what advice would you give to young female surgeons?
Luckily, in my practice, my partners have always treated me like an equal. Like it's never been like, oh, like the little lady surgeon. It's never been like that. And they even trained me, and they
Hmm.
never treated me like a trainee once I joined. So I'm very lucky in that sense. I get it more from patients, actually, especially male patients. So I've had patients, that's a funny story. So I had a patient come in. He saw me and one of my partners. My partner had previously done some lipo on him and he wanted a little more lipo. And at the same time, he wanted a neck lift. And my partner doesn't do the one incision deep neck that I do. So he comes in, he sees my partner in consultation. My partner is like, listen, I don't do the neck. We could do it together, but let me go grab Dr. Sarhaddi and have her come in. And she can just like do a consult with you real quick and we'll see if we can arrange it to get it both done at one time. Okay. So I go in, I do my consultation, and this patient, he's a nice guy, but he basically was like making sure that my older male partner was going to be in the operating room while I operated in a sense to like supervise me. It's
Hmm.
like he kind of was like, but doctor, you're going to be there, right? Like you're going to be there. And he's like, she could teach, like I need to learn from her on how to do this, which is funny because my partners are super supportive and they're like, I don't need to be there. No, like she's excellent at that kind of thing. And then when it came to the patient care coordinator, the guy was trying to negotiate my rates. He's like, well, like I don't, I don't want to pay that. Like, what about this? And she's like, this isn't a negotiation. That's her fee. That's her surgical fee.
Hmm.
So he ended up not having surgery and then came back 2 years later and was just like much more polite. Paid my fee, which
Yeah.
had gone up in that time. Didn't at all suggest that I needed to be supervised by my, you know, partner who didn't even do that procedure, that kind of thing. So that was,
Hmm.
I can take it in stride. It doesn't really bother me, but I definitely do, I clock it. Like I definitely notice. I'm like, okay, now you're much more polite and you realize that I do very good work and this isn't something that everybody in town can do and that I don't need a man supervising me in the OR. Thank you very much.
Yeah. Yeah.
It's stuff
Now,
like that.
do you guys determine your own fees, or is there kind of a group consensus on that? How does all that work when you're
There's
in
a
with
bit of a
other?
group consensus. We don't want to inside the group like undercut each other.
Hmm.
So for the same procedure, it will be the same price essentially for most of us. One of my partners is significantly busier than the other, so he's upped his prices a little bit. But that was like a discussion that we all had. He was like, I'm gonna up my fees, like you guys should too. And we're like, no, we'll stay where we are. That's fine. That kind of thing. But you don't want to get the sense that you're undercutting each other within the same practice. Because that just doesn't, I don't know if it's a conscious thing or subconscious thing, but the goal is to kind of make patients feel like you pick your surgeon, you don't pick your price type of thing. Like you pick the person you want to partner with, you want taking care of you, you want the person whose work you like the best, the aesthetic you like the best, and not to be like, well, Dr. Sarhaddi's, tummy tuck is, $3,000 cheaper than her partner's tummy tuck. I'll just go with her type of thing. Because that
Hmm.
doesn't really, I don't think it's a good way to do it.
For sure. Now,
Yeah. And it just keeps
wh-
things healthy.
where do you operate? Do you guys have an ambulatory surgery center that you all work at?
Girl, I wish. I wish we had our own. We all have privileges in different places. So one of my partners, each of them has their own like surgery center where they usually work.
Hmm.
And I have one where I usually have my own block time, and then we share practice hospital OR time for our bigger cases. So there are two hospitals. We have Monday and Friday block time for the practice, and then whoever needs like a larger block of time, like 8 hours, will go there. And then the surgery centers typically we can get most of our stuff done there, and those have like 6 hour limits
Hmm.
for like how long they'll let you operate place. So yeah, we each have our own little surgery center where we have privileges, but I wish we had our own. That's
Yeah.
one thing I would say. If you start a practice, get your own little surgery suite. It makes life 10 times easier. That's
Being
expensive.
of, yeah, oh, it is. Being 5 years out now, what is your average schedule for a week?
So it depends on the month. In the summer, it's pretty slow. Um, but last week, for example, I had my phone. I wish I had it. Don't remember anything I did last week. Typically Thursdays, I have a full day of clinic and consults. Monday, I think I had like fillers, injectables, and like office procedures, like little things. Um, and then I had two full face rejuvenations last week. So brow lift, facelift, neck lift, lower lid, that kind of combo, facial fat grafting. So that was one. So that's Monday, Tuesday. Yeah, Monday office procedures, Tuesday surgery, Wednesday surgery, Thursday full day consults and post-ops and pre-ops, and then Friday surgery. And then I had clinic in the afternoon. But that's
Yeah,
like a busy week for me. That's a
that
typically
is,
busy week for me.
that's a big week. How
That was a very big week.
do you guys have to take call at any hospitals for
Mm-mm.
like general plastics call? That's nice.
No, we don't take any call. We just manage our own patients. And the other good thing about having partners is that there are four of us. So, like, two of my partners are going to be gone most of July, and I'm covering for them. And in June, I traveled a ton and they covered for me. Like, it makes it so much easier, especially
Hmm.
because there's four of us, because without a doubt, someone's going to be in town and can kind of like mind the practice. And that's easy too. That's not like a big dramatic thing. I don't know how it is in other practices. Like, knock on wood, I feel very, very lucky that
Yeah,
things are just like easy peasy, simple, fair, honest, but it's a big practice. We have like 25 employees. It's a lot to manage.
that's great. Do you
A lot of
guys,
responsibility.
do you have any like nurse practitioners or physician assistants that work with you specifically?
We don't have MPs or PAs. So one of my partners has his own FA who works with him. Anytime he's operating, his FA is with him. And that obviously makes a world of difference. It's like,
Hmm.
I don't have my own. So I operate with the FA that the hospital provides if I'm at the hospital, for example. It's usually a small group of people that do plastics, like 3 or 4. But it's a little frustrating. It's like walking to work every day and being like, who will be my employees today? And it's like the operating room. So there is something
Hmm.
to be said to having your own FA. So one of my partners has his own FA and he always operates at the same surgery center. So that's easy. My other one has his own FA who's always with him and operates at the same surgery center for the most part. So they all know how he does things. My other partner works at a surgery center where they have FAs, so he doesn't have to hire his own. But again, it's like 2 or 3 people. And then the surgery center where I work can provide an FA, like a first assistant in the operating room. Um, but it just depends on the case. Like if I'm doing a breast aug, I don't need a first assist. I just need someone to like retract. But if I'm
Hmm.
doing, literally anything else, I'd like to have an extra pair of hands. So it just depends. And then, so we have nurse injectors. We have 3 nurse injectors, no PAs, no NPs. And then one of my partners is an RN, kind of as his person in the office, just managing the office stuff for him and taking care of his patients. And then each of us, I have an MA. She's amazing, actually. She manages my patients with me, not like medical stuff, but just like the logistical stuff.
Hmm.
Um, my other partner has an LPN and the other one has an MA. So it's kind of all, but we don't have mid-level providers that work with us like in the office, in the operating room, managing our patients. Like we don't
Hmm.
really do that. Works out really well. I don't know how other practices do it in terms of mid-level providers, but
Yeah, it sounds like you've got a great team and really the perfect situation to walk into where someone is, like you said,
job,
leaving
yeah,
Friday and you started Monday.
crazy. Very, very lucky. So I was never planning on staying in St. Louis forever, but that's the way things worked. And it actually turned out to be kind of a blessing.
What are you looking forward to in the future, career-wise?
Oh my gosh. I was just thinking about this yesterday. I'm like, well, it took us like 15 years to get here. We're finally here. I'm doing exactly what I thought I would be doing and work towards doing. And I was like, is that it? Like the rest of my career is just going to be like, you know what I mean?
Yeah.
Like the rest of it's just going to be like getting better at surgery forever. That's it. So I don't know. I do want more. I don't know what though, you know? Maybe like a side business or I mean you have your podcast, even something like that would be fun
Hmm.
to just like put on my plate, my very high piled plate. But
Yeah.
I don't know, you see a lot of surgeons who they have companies and they have businesses and they have podcasts and they teach and they travel and things like that, and I'm looking forward to doing more of that because it can't just be operating and then going home and then operating and then going home.
You can. I
It
mean,
can, it
yeah.
can, it can. I mean,
Yeah.
it's a lot in and of itself, but I don't know. Maybe it's because right now I like torture myself with surgery, and like photos
Mhm.
and picking at my results and trying to make it better and better. There has to be something else. Maybe
I
this is where
can't,
hobbies come in.
yeah. I can't tell you how comforting it is to hear other young surgeons talk about how they torture themselves because I do
Yeah.
too.
Oh, yeah.
Not that I want anybody else to be miserable, but it's a
No.
reassurance for sure.
Yeah. No, you're not alone.
What
Girlfriends
about
and
in
I
the
will talk
field of um, in the
medicine.
field of cosmetics, both in terms of non-surgical and surgical, what are some things you're looking forward to?
Oh, so I do injectables is like a large part of my practice and I love it. I'm not going to give it up anytime soon. Um, and a large reason for that is because I see it done so poorly. And there's such an echo chamber in like the nurse injector world. Nothing against nurses, but just in that world, because it's so separate from doctors for the most part, that I feel like education and training is a really big part of that. So I would love to get into training people on injectables and training people on aesthetics and anatomy. I think that's really important. And that way we can make people less afraid of getting injectables, but also keep them from looking crazy.
Mm-hmm.
Um, like it kind of scares me when I like meet someone, they're like, oh, like my friend is a nurse in the ER and she's going to start doing injectables like as a side gig. And right now she's just like going to people's houses and doing Botox parties. And I'm like, oh my God, like what? Like that to me is very scary. I'm like, A, please don't get Botox from a stranger that comes into your house. Please don't get fillers outside of a clinical setting where there's plenty of Hylenex there and like, you know, a little safety kit for occlusions. That stuff happens all the time. And I think people take it very lightly because they don't know what
Mm-hmm.
they don't know. And then on top of it, the aesthetics of it too. I'm like, why does everybody look weird? Why is this filler in the wrong spot? Like
Mm-hmm.
I'll look at pictures on Instagram, I'm like, why? Like,
Yeah.
you know, and again, I think most injectors are really comfortable with lips and cheeks and maybe jawlines. So you go around seeing people who have huge cheeks, huge lips, and like exaggerated jawlines.
Mm-hmm.
And I'm like, if they just had a little more training and like a little bit more of an aesthetic eye and just learned how to see things, then maybe they wouldn't forget about this part of the face, or like maybe they wouldn't overdo this part and people would look more normal. You
Yeah.
know,
One of my lines I tell
that would be
patients
fun.
is it's always better to look older than it is to start looking weird.
Yeah. Oh, yeah. And then
Yeah.
you see these young, beautiful 20-year-olds who look like ambiguously middle-aged because their faces are so overfilled. I'm like, God, you were so beautiful like 3 faces ago. Why? But it's that perception drift. Have you like seen
Uh-huh.
those? Yeah, that's what it is. You just lose track of what looks normal after a while. It's funny,
Do
growing up, my mom always
you,
said that about makeup. She was like, don't wear a lot
oh,
of makeup because then you're going to get used to wearing a lot of makeup and then you're going to wear more makeup. Like that was just like young me.
yeah.
And people do the same thing with fillers.
With, okay, one controversial topic, and then we will
Always.
probably wrap up. So, since you do a lot of facial work and we're talking about
Mhm.
overfilled faces, what is your approach to having patients dissolve filler before surgery?
It depends on the surgery. So if I'm doing lower eyelid surgery, 100% I'm going to have them dissolve their fillers. And it's funny because I would say 99% of patients who come in and I can see the filler. I can see
Mm-hmm.
it. Like I can see the Tyndall effect. I can literally see it in their tear trough. And I'll be like, "Oh, like do you have fillers under here?" And they're like, "No." I'm like, "Well, I can see it. Like, when's the last time you got it?" They're like, "Oh, it was like 7 years ago." I'm like, "Mhm. Still there. 100% still there." And I had
Mm-hmm.
one patient, so that I will definitely dissolve, and I usually dissolve it a couple weeks before surgery, if not a month before, so I can see them again and actually see what we're working with. Because I like to know what I'm getting into. And depending on how much they have, it could be a lot of camouflage. Um, but I dissolve filler at least 2 weeks before surgery, so the swelling has gone down too. Cheeks, I'm not so obsessive about dissolving filler. Um, Jawlines, I'm not so obsessive about it. Lips for a lip lift, especially if it's migrated up, I'll recommend that you completely dissolve it out and then you can lift it up and make the anatomy normal again and then go back in and put some filler and make it look normal.
Yeah.
That I see a lot. So usually around the mouth and around the eyes, I will. Um, I had a patient who I did a lower bleph on and she had like a pocket of edema right here. And I was like, is that like malar edema? Like, did I not go down enough to get rid of a malar bag? Like, I didn't even remember seeing malar bags on her, that kind of thing. And I'm looking at the photos again, torturing myself. I'm like, it's too far medial for malar bag. It's filler. It has to be filler. It's exactly where people would put filler, like right in the mid face.
Mm-hmm.
And she said she'd never had fillers. And I did a deep dive in her chart. And I was like, 7 years ago, she had a drop of filler, a literal drop right here. And that's exactly where the swelling was. For months, I was torturing myself. I'm like, give it time, do compression, this and that. Put a little Hylenex in, and it like basically resolved. I was like, lesson learned.
Yeah.
People will say they didn't have filler if they had it 10 years ago. It's still there.
Still there. Yeah,
Yeah,
fortunately, I think the pendulum is swinging back, you
maybe.
know.
But now, so one of my nurses, she's like, everyone's jumped on this bandwagon of nobody ever needs tear trough filler. I'm like, okay, well, sometimes it's appropriate. I don't know. I just don't agree with this like black and white, everybody needs this, nobody needs this, like headline grabbing type stuff, attention grabbing type stuff on Instagram with these like influencer injectors. Half the time, like, they don't even know what they're talking about. It's very bizarre to me. It's where like the education piece comes in.
Yeah. It's great that you're able to open up your phone and make some videos and educate those that are following you.
Should probably do it more often.
Well, Dr. Deniz Sarhaddi is
Oh.
located in Chesterfield, Missouri,
Mhm.
where if people are interested in either following you, reaching out for a consult, or a young trainee asking you some more questions, where can they find you?
Instagram is the easiest thing. I never check my Facebook. So at Dr. Deniz Sarhaddi on Instagram. And if you want to come in for consultation, calling the office is the best way, 636-530-6161, or just finding STL Cosmetic Surgery on Instagram as well. We have a wonderful marketing manager that kind of monitors all that and can get you to the right person.
Awesome. Thanks, Dr. Sarhaddi.
Thank you so much. It was such a pleasure.